Good morning, Trinidad and Tobago. Thank you for joining us for another Ministry of Health virtual media conference, which provides an update on the Ministry's COVID-19 response. Here to update us on some of the COVID-19 developments are the Honorable Terence Dayal Singh, Minister of Health, Dr. Roshan Parasram, Chief Medical Officer, and joining us soon will be the Honorable Shamfa Cudjoe, Minister of Sport and Community Development. I am Candice Alcantara, Manager of Corporate Communication at the Ministry of Health, and I will be your moderator for this morning's media briefing. We begin with an opening statement from the Honorable Terence Dayal Singh, Minister of Health.
Thank you very much, Candice. Good morning to the Chief Medical Officer and my colleague who will be joining us very soon, the Honorable Shamfa Cudjoe. Good morning, ladies and gentlemen of the media and the peoples of Trinidad and Tobago, wherever you are this morning. So today we have some significant announcements to make based on decisions that we have taken in the recent past, especially as it pertains to vaccine deployment and so on. What I will do firstly is give you an update on where we are with the deployment of the initial 2,000 doses of vaccines that we received from Barbados that were dedicated solely to the most frontline of frontline healthcare workers. To date, because of vaccine acceptance, and I want to really thank the University of the West Indies on this. We had a symposium, as some of you may know, about 2 or 3 Sundays ago, which was dedicated to healthcare workers. The associations that were invited would have been the TTRNA, who participated both virtually and in person, the Trinidad and Tobago Medical Association, who were there, both in person and virtually. We also invited the 2 doctors on the opposition benches, former Minister of Health Fuad Khan, who was there in person and also participated. It is because, I believe, of that session where we addressed the issue of vaccine acceptance by healthcare workers, and both nurses and doctors participated online. At the peak of attendance, there were over 600 persons online. That's a huge number. You could never have done that in person. But more significantly was the amount of chats that were going on at the same time. And I think because of that engagement with healthcare workers, I can now report to you the following figures of healthcare workers who have been vaccinated since Wednesday to now when we started. So the total figure vaccinated from Wednesday to yesterday afternoon is 400. That's a lot. And let me give you the breakdown. On Wednesday, we would have done 120. On Thursday, under North Central RHA again, they would have done 96. And on Friday, they would have done 76. So the facilities under the care of Northwest Regional Health Authority, which is responsible for ARIMA, CORA, Couva, and we also brought in some people from Augustus Long, in those 3 days was 292. Southwest yesterday started their vaccination program for mainly frontline of the frontline, and they did 108. So 292 plus 108, it rounds off to a very nice 400, which reminds me of Brian Lara's highest test score, I believe. TRHA starts today at 10 a.m., so they would have started an hour ago. They would have received 200 doses, which will go to the first 100 of their most frontline workers. We are very, very pleased with these numbers because it speaks to a high degree of vaccine acceptance by our nurses, our doctors, and healthcare workers. So these numbers are very, very encouraging. So we have another 600 to go of the frontline healthcare workers. We then stop there and reserve the second 1,000 for these people to get their second shot or their second dose. And the CMO will tell you what the timeline will be. So that's encouraging. Where are we now to deploy the 100 to 120,000 doses that we expect sometime in March from the COVAX facility? So I will give you some details of what we've been working on behind the scenes. We have finalized a lot of the details on Friday gone. What we have done is identify 20 sites throughout Trinidad and Tobago. The sites are broken down as follows. TRHA, 3 sites. Southwest RHA, 7 sites. ERHA, which spans from Toco to Grande down to Mayaro and Rio Claro, 3 sites similar to TRHA. And Northwest RHA will have 7 sites. So if the math is correct, we have 20 sites distributed around Trinidad and Tobago. So when the COVAX shipment arrives, we'll be going deeper down into our healthcare workers and our NCD clinics. We are also targeting our homes at this point in time where our long-stay patients stay, and that is being coordinated by Dr. Rohit Doon. So that is where we are in terms of sites. Sites are chosen in terms of their physical capacity, their layout, ICT, ability for resuscitation equipment, and so on. The ICT, which we develop in-house, which tracks patients and where you enter the data on patients, including reminders for when they have to be coming, I am proud to say has been developed in-house. And I would like to thank Jesse and his team for doing that. It has actually gone live because we have these 400 patients who we use as our initial entries into the ICT program. Of course, there were 1 or 2 little bugs to work out, so we have worked it out. And when we go more live with the 100,000 doses throughout these 20 facilities, all the bugs should have been worked out by then. But the program is a very simple program, but captures all relevant data. It is easy to use. We have received 20 laptops from PAHO. I want to thank them. And these 20 laptops, 1 each will be dedicated at each of these 20 sites where the software will be loaded up, training is being done, so that we could, as seamlessly as possible, launch this ICT part of the program. It brings me now to our communications program, because this is important. We have developed and we got the detailed integrated marketing communications plan on Wednesday. What will be rolled out over the next 7 days first is a media workshop where we'll be engaging editors, heads of news, and the reporters like yourselves who report on health. This is to sensitize you as to the vaccine rollout. And so this will be done via a media event within the next 7 to 10 days, as I said, targeted to heads of news, media correspondents, editors who report on health. One of the areas that we are going to start to sensitize the media and the population on is the difference between side effect of a vaccine or a drug and adverse events. The CMO may go into some detail this morning, but we are bringing Dr. Don Martin on the press conference on Monday. Dr. Don Martin, as you may recall, was one of the first persons to receive the AstraZeneca vaccine on Wednesday. Because what we would like media personnel to understand, so that we could have accurate reporting and you need the information, is that there's a world of difference between a side effect and an adverse event. I would not go into details here, but the CMO can go in there, right? So that is what we are be going there. We are also going to roll out our plans based on the internal healthcare focus groups that we had. So we had internal focus groups on healthcare workers. We are going to have our media workshops. We are going to have our public workshops. We are going to be launching this on all media channels, including social media, and a webpage dedicated solely to the vaccine rollout. Because when we did our workshops and we asked people, where do you get your news? How are you informed about vaccines or anything else? The number one media source is social media. And we knew that from day one, but it's so nice to have it reaffirmed by a focus group. So there's going to be a heavy social media presence across the board. We have a dedicated person and team dedicated solely to giving out accurate, up-to-date information on vaccines, what they mean, on vaccine acceptance throughout the country. So that is where we are right now with our plans. Just to recap, we have already to date distributed and given out 400 vaccines across the health sector in Trinidad. This has exceeded our expectations. Tobago starts today. We have identified 20 sites throughout Trinidad and Tobago. Our software platform has been developed, already launched, working through the glitches, as you would expect with these 400. And then we start our media sensitization next week. But first of all, we go to our editors, heads of news, and so on. To support the communications plan, we are rejigging our hotlines from the COVID hotlines, where people were reporting on COVID symptoms and so on. We are now rejigging that to a vaccine hotline. But we don't want everyone calling the hotline. We are going to make as much information available to you online and social media, so you will call the hotline only for issues that, for special populations that don't have access to the internet and or personal questions you may want to ask. So that is where we are, and I'm so happy to be here this morning to share all this information with you. And Candice, I want to thank you for the opportunity, and over to you.
Thank you very much, Minister Dayal Singh. And we go now to Dr. Roshan Parasram, Chief Medical Officer, who will present the clinical update.
Hi, good morning, Honorable Minister, members of the media, members of the viewing and listening public. So we'll begin first with the clinical update for February 19, 2021. So in terms of our tests done so far, we are now at 93,211. In the last 24 hours, we would have reported 0 cases, new cases, so our total would have remained at 7,666 since the 12th of March to present. With regards to our recovered patients, we're now at 7,384, with a total number of active positive cases now standing at 143. We have one additional death overnight, and that takes our tally to 139, and condolences go out to the family of that person. Our total hospital patients are now at 16. Those in our step-down facility are 2. Our total patients in state quarantine facilities are 279 as of yesterday, but we would have had a lot of discharges overnight, and we now stand as of this morning at 96. Our total persons in home isolation are now at 125. With regards to a little more detail in terms of our hospitals, this is one of the lowest occupancies we have seen in many, many months. So at the Couva Hospital and Multi-Training Facility, we have 16 persons. 2 of those individuals are at the ICU, 1 person in the high dependency unit. Just to underscore, we have no one at Cora at this time, no one at Arima General Hospital, no positives at Augustus Long Hospital, St. Anne's Hospital, or both areas of Scarborough, which are Fort King George and Signal Hill. With regards to our step-down facilities, we have 2 persons at the UE Debe Hall at this time, no persons at Claxton Bay or in Tobago. So with regards to our 96 patients, how they are distributed within our parallel system, we have 2 persons at Cascadia, 1 at the Chancellor Hotel, 4 persons at the Paria Suites, 48 at UE, St. Augustine, there's 19 at the Napa, Tradewinds Hotel, there are 5 persons, Cape Up Hotel 8, and at the Regent Star, there are 9 individuals, giving us a grand total of 96 at this point in time. Minister had mentioned the second dose interval. So there's a study that would have been done, and the name is a bit long, but I'll go through it anyway. So it's a single dose administration and the influence of the timing of the booster dose being the second dose, on the immunogenicity and efficacy of CHAD Oxford 1 and COVID-19, which as we all know as AZD1222, which is the AstraZeneca vaccine, a pooled analysis of 4 randomized controlled trials. So basically, they would have done a trial to see what the effect of varying times of giving the second dose, less than 6 weeks and then more than 6 weeks, to see what the efficacy of the vaccine would be in those particular populations. What they found as the results of the study is that in persons who would have received the vaccine less than 6 weeks, those individuals would have showed an effectiveness of somewhere about 55.1%. When the vaccine, the second booster, was delayed anywhere between 8 weeks to 12 weeks, closer to 12 weeks in some instances, a vaccine efficacy for the AstraZeneca Oxford was given in the region of 81.3%, which is significantly higher. In so doing, WHO would have taken this evidence and others into consideration. And when they looked at the interim guideline, they of course would have said on the interim guideline that the second booster for the AstraZeneca vaccine should be given anywhere between 8 weeks and 12 weeks. Now, Trinidad will also take into consideration, and we will stick within the time frame of 8 to 12 weeks. However, we will look at the expiry of the vaccine when it gets into Trinidad. So this particular vaccine usually has a shelf life of about 6 months from the date of production. And that will decrease, of course, in terms of transit. It will take some time to get here and then get out from our main stores into the counties to begin utilization. So we will stick with our time frame of 8 to 12 weeks based on what shelf life we have remaining when that vaccine actually gets into Trinidad and Tobago. We will try to get as close as possible to 12 weeks for our second booster as possible. When you are administered the vaccine at one of our sites, the healthcare worker will give you an appointment for your second dose. So you don't have to calculate it on your own. Something will be assigned to you, so you will know when you have to come back for your second dose. Minister would have alluded to, again, the difference between side effects versus adverse events. So a side effect, generally speaking, of any vaccine, and we have seen this with the distribution of our existing vaccine, the most common side effects are things like pain at the injection site, which usually lasts about a day or two in most instances. We have low-grade fever that occurs, usually about 38.1 to 38.5 in terms of the temperature, and again subsides on its own, or you can take paracetamol to control it for about 2 days. Some degree of fatigue has been seen with most vaccines around the world. Those are side effects of the vaccine. They are mild side effects. Side effects, of course, can be severe, as we have seen with certain vaccines, causing allergic type reactions as well. But basically, an adverse event is something that is untoward. It is a significant event, for example. It can be something that post-vaccination that requires a patient to be hospitalized, as we have seen with certain vaccines. Severe allergic type reactions are an example of an adverse reaction. Although it is a side effect, it requires some significant hospital-level intervention, or it can be an event that occurs that results for some persons in some other type of reaction or something that needs to be documented. So in Trinidad and Tobago, there is a process that we have applied for many years so that if an event occurs, that we can document it. And with this particular vaccine, we have put a second check and balance in place where persons will be contacted by our telemedicine branch on a continuous basis for a period of at least 2 to 3 weeks, and then they are again followed up for about a year to see if they have any adverse reactions. So, Candice, that's my clinical update for this morning.
Thank you very much, CMO. And we are very pleased this morning to welcome to the podium the Honorable Shamfa Cudjoe, Minister of Sport and Community Development. And we go to her to give us her presentation. As you know, COVID is a national matter, and we're very happy to have Minister here with us. We go to Minister Cudjoe.
Yes. All right. Thank you. Good morning. Good morning, Trinidad and Tobago. I'm pleased to be part of the press conference this morning, and I'm here to simply announce that we are going to continue our rollback measures, and today we are opening up to be able to have sporting activity taking place for recreational purposes. At this point in time, we are only going to focus on sporting activities that caters to 22 or less people, and we are not going to open up yet for leagues and that type of larger activity that may attract larger crowds. So I'm pleased to announce this rolling back feature, and that we are getting ready to go out and play once again. So thank you very much.
Thank you very much, Minister Cudjoe, for that very important announcement this morning. And ministers, as you know, we get questions from members of the public on a continuous basis about COVID-19. And before we go to the media questions, these questions have been coming to us so often that we decided this morning we would address them. The first question that we are receiving consistently is this: if persons are vaccinated outside of Trinidad and Tobago, do they need to quarantine when they come back into Trinidad? And these questions are coming from persons who have family members who are nationals that are outside of Trinidad and Tobago and have been vaccinated internationally. And I think we'll go, Minister, you'll handle that question?
No, let's see.
CMO? We're going to CMO for a response, please.
So as of now, the quarantine process remains the same. So just to reiterate what it is, persons are required to have a PCR 72 hours in advance to boarding the aircraft and coming to Trinidad. When you get here, there's from high-risk countries 7 days of state or state-supervised quarantine, followed by 7 days of home quarantine. It remains in place for now. For a couple of reasons. One, the recent evidence suggests that the AstraZeneca vaccine may have some role in decreasing transmission up to 67%, which is very good. And it lends itself further on down the line to possibly looking at reductions in quarantine time for those individuals who would have had that particular vaccine. With regards to the Pfizer vaccine, which is the only other vaccine that has been approved by WHO at this time via EUL, the research is still ongoing to see if there's a decreased possibility of infectivity. I believe that research is being done in Argentina and some other parts of the world. So once we get that data back, there may be, in the coming months, some change to the quarantine process. However, we have to wait on those results before we can make that determination, and it will be specific to the type of vaccine that you have as well, based on the research that is before us, bearing in mind that persons who are vaccinated at this point may potentially still be able to transmit disease, be infected. However, they present less symptoms and less severe disease. So we are holding our position as of now, and we are looking at the research and the data that is coming forth, and we will keep considering our position as the data comes back into us.
Thank you very much, CMO. And we have two other questions that are sent to us repeatedly. Another important question: how do persons with NCDs who attend private facilities and are not on the CDAP list of recipients, how do they get high-risk status to be prioritized to receive the COVID-19 vaccine?
Okay, so in terms of NCDs, so there are a few ways that persons can get vaccinated. One, they belong to an existing NCD clinic, meaning a clinic for diabetes or hypertension and the like, within one of our public care settings. So those individuals there will be an active outreach while they are in clinic to actually have them vaccinated. There's also, as the question asked, in terms of our CDAP list. So we have a listing from CDAP, which was generated from NIPDEC, that gives us in excess of 80,000 persons that we can call upon and those persons would be vaccinated as well if they are outside of the NCD clinics. The private sector, we have a partnership with the private sector for those persons who may not be on CDAP and may be outside of our public sector clinic, where we will be working with the private sector physicians, TTMA, to distribute vaccines to them so that those persons can have their vaccines, the known ones, to the private sector. And of course, if persons can still walk in to our health centers that have been established for vaccination for COVID outside of that arrangement, and once you have diabetes or hypertension and you have a medical history of the same or any other NCD, you won't be turned away, you will be vaccinated at that point of clinical consult.
And the last question, will older persons with NCDs be given priority over younger persons with NCDs?
So it's basically two categories, two distinct categories with some degree of overlap in phase 1 of a vaccination plan. So those with NCDs alongside the vaccination efforts will run in parallel. So any person with NCDs plus any person over 60 will be vaccinated in parallel. So they will be commingled in terms of the time. So I don't think there will be a priority per se for those with NCDs as opposed to those over 60. We're trying to do both of them in parallel at the same time.
Thank you very much, CMO. And we go back to Minister Cudjoe, who has some additional information related to the announcement this morning.
Thank you very much. I would like to add that as a main feature of this rollback measure, we are allowing outdoor sport only, and that would be for recreational purposes. I want to repeat that we would not be rolling back for sport that are indoors and sport that require leagues and national competitions and so on, or even community competitions just yet. This is solely for the purpose of those who want to go out and play for their physical fitness and for their mental health. So it's important that sporting buddies, sporting enthusiasts are knowledgeable and they understand what we are doing right now. It is important that we scale back or we roll back slowly and we monitor the situation properly before we encourage larger gatherings. So I want to make it abundantly clear that we are rolling this rollback measure to allow sporting outdoor sports is for recreational sport only. We're not encouraging leagues and competitions and other activities that require gathering or sporting indoors. Thank you.
Thank you very much, Minister. And we go now to the question and answer segment. Members of the media, please state your name and the name of the media house that you represent before posing your 2 brief questions, please. And please, both questions at the same time. We begin with questions from TTT.
Good morning. Terry Ann Brown Campbell from TTT. My question is to the CMO. Could we have just a little bit more detail on the person that died, please? Whether it's male or female and the age.
Okay, I think it would have been on our website, but I believe it's an elderly male. If I want to go into detail of the specifics of the age so that we don't have that patient confidentiality, as you know, is still utmost in our minds, but an elderly male with comorbidities.
Thank you very much. And we go now to Newsday, please.
Good morning, Janelle D'Souza from Newsday. First off, have you seen any adverse effects from the 400 that have already started to have been vaccinated so far? Also, in various discussions with the vaccine distributors, how far along is Trinidad and Tobago in those discussions and when it comes to ordering and so forth?
Thank you very much. I believe CMO will take the first question. Yes.
Right, yeah. So I have been in contact with some of my colleagues and the CEOs as well. What they have been complaining of is, and is expected, are basically mild pain at the injection site, as well as some of them have complained of a little bit of fatigue for about a day or so. And those are the major ones that we have been seeing so far. They have not reported any severe side effects of the vaccine.
Right, so I'll take the second part of the question. Thank you for asking. We have always been in contact bilaterally with vaccine manufacturers. The Ministry of Foreign Affairs is also in contact with the government of India. I believe they would have sent out a press release this morning. The bilateral talks that the Ministry of Health is having with some of the vaccine manufacturers are well advanced and in a sensitive stage. And as I indicated at a press conference earlier or in the Parliament, we have signed confidentiality or non-disclosure agreements with them. So I wouldn't like to give too much of details which could jeopardize the negotiations and jeopardize the receipt of vaccines into Trinidad and Tobago, but rest assured, we are pursuing many different avenues for vaccine acquisition.
Thank you very much, Minister and CMO. We go now to AZP News, please.
Hi, good morning. Priya Bihari, ACPnews.com. Minister Cudjoe, I just wanted to get an update on the World Cup qualifier that will take place on March 25th with Guyana. There has been requests to have this the players be in a bubble, so when they enter, they can train immediately. Is there? Yes. So can you just give me an update on that? And the other question, I think maybe for the CMO or the Minister of Health, there has been some issue about who actually got the first COVID vaccine, whether it was Nurse Prabhat Gomez or doctor. Can you get some clarification on that, please? Thank you.
So I'll take the second part first. As far as I'm aware, NCRHA arranged the event on Wednesday, and as far as I'm aware, Nurse Gomez was the first, and Dr. What's his name again? I just called his name. Dr. Don Martin.
Dr.
Yes,
Martin.
yes. Were in fact the second, as far as I know. But I'll ask NCRHA. They arranged the actual event. Thank you very much, Brian.
Okay, I will take the first part of the question regarding the World Cup qualifiers. Yes, the TTFA will have applied to the Ministry of Health for permission or for clearance to have the players come in to play the game here in Trinidad and Tobago. And the Ministry of Health would have responded to TTFA offering three options. To one, bring the players in time so that they can quarantine and play their game. Two, to set a date to a later time to allow the players to come in and properly quarantine. Or three, to play the game on a mutual ground within the Caribbean or anywhere within the Caribbean and the Americas that the both teams could agree on. And those are the three options being offered to TTFA at this point in time. Looking at the date planned for the game, which was February 25th, at this point in time, today is February 20th. I don't see option one being possible for TTFA at this point in time because we are only 5 days to the game. So it would be a matter of one, changing the date of the game, or two, agreeing on to play on another grounds. I've had the opportunity to reach out to some other stakeholders within the Caribbean and representatives of the football fraternity within the Caribbean, and I'm well aware that FIFA would have offered the advice to countries where we have these protocols in place as it relates to COVID, that they can arrange to play in other places. So I know for sure that the Barbados team is playing in the Dominican Republic. Okay. Anguilla is playing in Tampa, and then they're playing the second game in the Dominican Republic. Antigua and Montserrat teams are playing in the U.S. Virgin Islands. The St. Vincent and the Grenadines, they are playing in Curacao. Barbados is playing in the Dominican Republic. Suriname is playing in the Dominican Republic. And when we were first approached by TTFA, one of the options was to play in Curacao. So I'm thinking that TTFA may lean more towards playing in Curacao at this point in time. It's important to note that the request was made on February 2nd, and that provided not too much time for the negotiation between the Ministry of Health and TTFA. But we must remember, as passionate as we are about wanting to play at home on home grounds and wanting home ground advantage, our priority is to ensure that our citizens are safe, that even these same footballers who are coming in are safe, because they are coming from places like Denmark, the United Kingdom, the USA, and other places where other strains of COVID, the South African strain and the UK strain, are seen. And we have to be very careful here in Trinidad and Tobago, just like the other countries, Barbados, Suriname, St. Vincent and the Grenadines and so on, to ensure that we protect our people, protect even the very same players, but also participate in football so that the game could be played. And I think the suggestion that TTFA would have made earlier to play the game in Curacao, as is being done by St. Vincent and the Grenadines, I think that option should be taken. But at the end of the day, we await the response of TTFA on this matter. Thank you.
Thank you very much, Minister, for that very comprehensive response. We go now to CNC3.
Hi, good day. Renuka Singh at Guardian Media. Minister, has the state implemented any routine testings for persons in high-risk jobs or contact-intensive jobs like immigration and policing? Or is testing still voluntary and only if the person is traveling?
Thank you, but I think that's more a technical question for the Chief Medical Officer. Dr. Parasram?
Yeah, so the testing protocol has remained the same in terms of our, we test persons that present to our facilities with symptoms or those that would have been in primary contact of a known positive case. Testing has always been voluntary and continues to be voluntary. I'm not sure about that bit about testing persons who wish to travel. Travel testing within the public system doesn't cater for persons wishing to leave the country, being a prerequisite to enter another country. So we maintain our guidelines, which is testing symptomatic persons who present to us and their primary contacts, and if need be, secondary and tertiary contacts, depending on the type of contact they would have had, the duration, the exposure, and the relationship. So that remains our protocol for testing at this point in time.
Thank you, CMO. And now to CL Communications, please.
Hi, good morning, everybody. Are you hearing me? At this point, I need to find out.
Let's try again. Okay, unfortunately, we're not hearing Ms. Singh very well. And while we address that matter, I think we will move to TV6 at this time.
Hi, good morning. Cindy Raghuba, TV6 News. Two questions. I'm not sure whether the Minister or the CMA will be able to address it. In terms of rollout of vaccination, is it strictly going to be voluntary at this point, or will it be mixed with targeting specific populations, those most at risk? How do you all plan to do it? Are you all inviting in batches specific populations, inclusive of migrants? Because I know that we're going to be allowing migrants to also access vaccines. So are we going to invite in batches? And the second question, with respect to the 20 sites, can someone from the east access it in one of the facilities in the south? And with those sites, is it going to be at like health centers?
So thank you, Cindy, for your very important questions. Vaccinations are not mandatory. We cannot force or compel somebody to be vaccinated against your wishes. So if you, Cindy, I'm just using you as an example, you don't wish to be vaccinated, the state cannot compel you or forcibly vaccinate you. So that is point number one. It is voluntary. On the issue of immigrants, yes, government's public health policy, as determined by a cabinet note of June 2019, is that all immigrants in Trinidad and Tobago, regardless of their country origin, can access certain public health goods and services absolutely free of charge. One being vaccinations, whether it's the flu vaccine, yellow vaccine, tetanus, and now the COVID vaccine. So yes, migrants will be included in that group when we reach there. You asked a very important question, is something we addressed. Can someone go to one site, let's say in ERHA, and then go to San Fernando? Yes, it can be done, but we are urging people to choose a site to make it easy for us and yourself. So if you live in Sangre Grande, access the vaccination sites at one of the 3 centers in the ERHA. I know, Cindy, you cover a lot of South. So if you are living in South, domiciled in South, we urge you to be vaccinated in South. It will make it so much easier for both yourself and us for record keeping if you go back to the same site to be vaccinated. But exceptions can be made, but we are encouraging people to get their second shot in the same site where they got their first shot. So Cindy, thank you for those very important questions.
Thank you, Minister. And we go now to Newsday for a follow-up question, please.
Yes, to the Minister of Sport, the Arima Race Club has actually sent out a release saying that they have 50% spectator approval at events. Is that the case? Just clarifying.
So Arima Race Club does not fall under the Ministry of Sport, it falls under the Ministry of Trade. So they would have applied to the Ministry of Health. What is allowed, and I had this discussion with Minister Paula Gopi-Schoon and also the Commissioner of Police, because it's a betting type outlet, they are treated in the same way as casinos, so they can have 50% capacity, but the same provisions apply, no alcohol, social distancing, and so on. So racing can continue under those. So no exception has to be made. I'm advised by the legal department it is allowed under the current regulations, and we indicated that to the Arima Race Club, the Minister of Trade and Industry, and the Commissioner of Police.
Thank you very much. And we're going back now to CL Communications for their maximum of 2 questions, please.
Hi, good morning. Good morning, everybody. I just wanted to find out what is the bilateral relations with, or what's it like when it comes to India? Has it been shattered, or is it that it's very much intact? And then secondly, I wanted to find out what the logistics was like at the various center sites. Are we going to see long lines? Are we going to see overcrowded? What is the logistics going to be like when it comes to issuing or distributing those vaccines to members of the public?
Thank you. So no relations has been shattered. I don't know the origin of that question. No relations has been shattered as one. 2. As we indicated, with these 20 sites, this is going to be done mainly by appointment, but we will be catering for some walk-ins. So in the first instance, the healthcare workers at those sites will be making appointments, and the persons with NCDs, they will already have appointments to come into their clinic, so that's their appointment, and they will be offered the vaccination at the same time. There will be some accommodation for walk-ins, and let me explain why on a policy level, and then the CMO can go into details. He can give you the actual details. When you open, the vaccines come 10 shots to 1 vial. When you open a vial, you have a certain time frame to use it out. So let's say we have the last appointment for the day, and we have to open a vial. Do we turn away that patient and say, okay, you can't get your vaccine because if we open it, we don't want to waste 9 doses? Or do we open it, vaccinate him who has an appointment, and then look for 9 other walk-in people or call 9 people from the community? So those are some of the technicalities we have to look at, and now the CMO could take it from there.
Yeah, so I think Minister would have covered most of it in terms of our vaccine drive. So the 20 sites, again, Minister said, you have our NCD clinics who are persons that already have an established appointment to come in. Those persons won't be will be accessed at the same time, so you'll be offered the vaccine while you wait your appointment. And that's really to improve access, because you don't want those persons to have to come on another occasion to have the vaccine. So we are offering it at the site while you're there. Walk-ins are catered for as well. And then, of course, appointments. Most clinics would have appointments for NCDs on 2 given days. On the other days, they either have walk-in clinics, child health clinics, or maternal clinics. On those days, we will be giving persons appointments, those over 60, possibly those with NCDs from other health centers who are not the primary health center, so that they can also get their vaccines early on in the tranche. So we want to cater for the other districts that are not served by the primary health center in that instance.
Just before you go, just alert us, what is the viability period once you open a vial and that you have to use out the other 9 doses after you open to give one?
Existing viability, once you take the first dose out, so once you puncture the actual seal on the vial, is 6 hours from the time of puncture. So we have 6 hours in which we can use that remaining number of doses. One option, as Minister said, is to find someone within the vicinity to vaccinate. Another option that we have explored is actually taking that vial and now taking it under controlled temperature to a neighboring health facility whereby it can be used to avoid wastage during that time.
Thank you very much, CMO and Minister. We go now to AZP News for a follow-up question.
Yes, good morning again. I just wanted to clarify with the Minister of Sport. Minister, the World Cup qualifier is actually on March 25th and not February 25th, as you said. And if it is that FIFA has made the request on February 2nd, do you think that is enough time for them to have the game here? And based on the options you give, is it that a bubble that took place like with the CPL has been ruled out in terms of this match on March 22nd? Thank you.
Thank you very much. Let me specify. TTFA had made a request for 2 sets of games. One set to take place in February, on February 25th, and the other set of games to take place in March. I think the February games are friendlies, and the ones for March are the actual qualifiers. So as it relates to doing a CPL type of quarantining, we must remember that for CPL, they quarantined for 14 days. They quarantined 7 days and then another 7 days in the bubble. Now, TTFA is stating that their players cannot quarantine, and that's troubling for us here in Trinidad and Tobago, where we must quarantine, especially with players coming from the United Kingdom, coming from Denmark, coming from Belgium, coming from countries where there are these strains that we are really concerned about. So it's either one, we bring in the players in time. The option is still open for them to bring in the players in time to quarantine, and then practice in a bubble and play in a bubble. We're talking here about countries like Barbados, where the national team had not been able to even practice since December. We were able to practice, yes? And in having these international players come in, and the proposal was for them to come in, travel from the airport to the home of football, play their games, stay for 2 days, and then go back out. That does not provide any time really for them to quarantine. The proposal has also asked to have them roomed, 2 people to a room, and the other protocols that are required to keep our people safe, to keep even the players themselves safe. The CMO was very concerned and has offered those 3 options. In my capacity as Minister of Sport, and even in Minister Dayal Singh's capacity as Minister of Health, if we are really concerned about the health and safety of our people and the players, it's not our business to question the protocols of the CMO. And I trust that the technical people in the office of the CMO would have done their work and would have been able to identify what is safe for us and what is not. And flying in, traveling to the home of football, playing your games, no quarantine whatsoever, it doesn't sit well with our technical with our technical people, and we are in the position that we are in today as a country to even be commended by the World Health Organization because we have not made political decision, or the Minister of Sport or the Minister of Health didn't bully the CMO. We listened to the advice, we follow the advice. The option are still open for the players to come in time to do the quarantining and then go ahead and play. As you said, we're looking at March. But for players and the TTFA to make the offer that, yes, we want to come, yes, we want to play, but we are not willing to quarantine, that is not the current protocol being followed or being advised that had been given to us by the CMO. So I have to agree with the CMO, and it is not my business, as it's being recommended, that I instruct, or the Minister of Health instruct the CMO. We have to trust his advice to keep our people safe and to keep even our players and the rest of the sporting fraternity safe. I think just like the other countries would have explored the other option and adhered to the advice of FIFA and CONCACAF to find a way of playing on neutral grounds. We see other countries traveling to Tampa, Florida, Dominican Republic, Curacao, and even TTFA themselves would have recommended Curacao in the very early stages of the communication with Minister of Health. So at this point in time, the options are there, and it's up to the TTFA to say whether or not they are willing to bring these players in time so that they can quarantine. But to come in and to not quarantine, the CMO is not permitting that at this time, and it is my duty as a member of Parliament, as Minister of Sport, to adhere to that advice and do what is necessary to keep our people safe and to keep the players safe and the sporting fraternity safe. Thank you.
Thank you very much, Minister Cudjoe. And we go to TTT for a follow-up question now, please.
This question is for the Minister of Sport. Just a clarification. Is the rollback with immediate effect?
No, so that question is for me. So let me tell you how these adjustments work. Whenever the Prime Minister would have announced adjustments in the past, and this is the first time we are announcing an adjustment without the Prime Minister, but we are acting on his advice. The announcements are normally the announcements are normally made on a Saturday. The Honorable Attorney General is then receipt of those announcements. The regulations have to be crafted and drafted by the Chief Parliamentary Counsel. The CPC then sends the drafts to the Attorney General. The Attorney General then sends that draft to myself, the Minister of National Security, and the Honorable Prime Minister. We go through the drafts. Any corrections, because a slight comma, a slight grammatical error could, make the regulation say something totally different. So it's a legal process that has to be gone through. Then by about Sunday evening, Sunday afternoon, depending on the complexity of the adjustments that have to be made, once the Honorable Prime Minister signs off on it, then the Honorable Attorney General sends me a final draft. I read it, vet it, and then I sign off on it. And I normally sign off on these things by Sunday evening, Sunday night. Then it goes to the government printers. A cabinet note has to be generated to give effect to all of these measures. So it's a very long process. And then the measures normally come into play midnight on Monday. So, Terry Ann, what the Minister of Sport has just said, you could start to kick ball. Where do you live, Terry Ann? You could start a kickball in Skinner Park Monday, right? And my constituents could start a kickball and hitball in Arangua Savannah Monday. So everybody could start a kickball and hitball and bounce ball on Monday. Now that you have the process down pat. Okay? Thank you for the question.
Thank you very much, Minister, for edifying us this morning. We go to TV6 now, please.
Here again, just a follow-up question with respect to migrants. Will non-registered migrants be able to access the vaccines? I know that they currently access services at the hospitals right now. That's non-registered migrants. So is it going to be open to them as well, the non-registered migrants?
Okay, Cindy, thank you for the question. So as we have said, I remember the language I use. Any human being in Trinidad and Tobago, regardless of status, you could be from any country in the world, in whatever circumstance you find yourself in Trinidad and Tobago, it is policy to vaccinate any human being in Trinidad and Tobago. So I hope that answers your question, but it's an important discussion to have. So you could be registered, non-registered, you could be from any country in the world. You can access the vaccine when we reach that tier of vaccination. Cindy, thank you for that question.
Thank you very much. And I see that AZP has another question for us this morning.
Yes, good morning again. I just want to find out the second booster shot, the second dose, is it the same as the first? In other words, is it the same injection they will use from the same vial, for example, to have the second dose? I don't know if you understand. I mean, in other words, is it the same ingredients or what do you call it? The first dose and the second dose.
It's not the same vial. It will be the same vaccine. So you could take a paracetamol tablet today from one bottle. You could take a paracetamol tablet 2 months again from a different bottle. You will not get it from the same vial because, as the CMO has said, once you puncture the seal, it is only viable for 6 hours. But it will be the same vaccine, but from a different batch. Okay?
Okay, thank you very much, Minister. And I don't see any more questions from the media, going once, going twice. And so we have come to the end of this morning's proceedings. Thank you very much to our ministers, the CMO, members of the media, and all our viewers for joining us today. We got some encouraging words and encouraging announcement today, and we can look forward to a rollback measure which will allow for outdoor recreational sport in limited numbers very soon. Trinidad and Tobago, please keep doing what we're doing if you're doing the right thing, and those of you who aren't, please make the responsible decision to follow the new normal guidelines, including wearing your masks. And please get information from reliable sources, information on COVID-19 and on the COVID-19 vaccine. Do have a good day, and please wear your mask.